Hi, everybody. My name is Julia Rousey, and I will be doing my seminar presentation on the healthcare system during COVID-19, kind of post-COVID, during COVID, and what they're doing to improve their healthcare system and how they are dealing with COVID in general. My name is Julia, and this is for Professor Rao's COM 460 seminar class. Okay, so introduction. So like I said, the topic is about the struggles of the healthcare system during COVID-19 and whether the use of digital rhetoric has improved or disrupted, stalled their communication and outreach to the community. So I have a general question, which is basically, how has digital rhetoric helped improve the healthcare system? Um, in short, which I will cover later in the presentation, in short, I think that it obviously has helped improve the healthcare system because it opened up a whole new door of communication and accessibility for our patients, their patients. So telecommunication is how the healthcare system is expanding. A definition that I found on one of my websites that's in the sources reference pages is a branch of science which use electronic communication or audiovisual technologies for exchange of medical information from one location to another with the goal to improve patient healthcare. So telecommunication basically is any kind of video sharing, video chat, texting, calling. Skype is an example that's very popular that people use socially. Telecommunications had opened a new way for healthcare to help their patients because it allows patients who are homebound, who aren't able to go to any doctor's appointments or checkups or anything like that. It allows them to do it technologically so that they still have that access and honestly, even human connection with their doctor so that they can sustain that doctor patient relationship. Some advantages of telecommunication that I looked into was the effectiveness of treatment. Studies have shown that some people who are more introverted, excuse me, are more comfortable doing a video conference than they would be to actually go see the doctor in person. So because of that, it has been shown to improve not only the relationship, but the patient's attitude towards the doctor's appointment. Flexibility, time wise, when it comes to a video conference, it's really, it allows for a bigger time frame. It cuts out travel time, which is another advantage. It's less travel time, cuts out travel time, saves with gas. Um, Honestly, you could stay in your pajamas. You don't have to change or anything when you're talking to your doctor. Um, it just allows for a whole umbrella of you being comfortable with your doctor and being able to take care of what needs to be taken care of. A lower threshold for contact. This is huge, especially for our time when we were having to go under quarantine. Um, like I said, especially people who are immunocompromised, who couldn't leave their houses even after the quarantine was lifted. Um, it just allows them for their own comfortability and not having to leave the house or even go into a doctor's office because of all the germs and everything that could be in there. And the last one is really just accessibility of mental health care. So um, it just opens this huge door of possibilities to where it makes the doctor comfortable, it's convenient for the doctor, convenient for the patient, and really just improves the telecommunication, excuse me, the relationship between the doctor and the patient. Some disadvantages that I found with telecommunication and telemedicine is first the difficulty of adapting to technology. So this can range from age to just what you may know about technology versus what you don't know. I say age because elderly patients, when they have to have doctor's appointments, it's easier for them to go in person because they're right there with them. They have that face-to-face contact. Any questions that they may have can be answered right there. With um, difficulty adapting to technology, some elderly people, I know my grandmother does not know how to even work a computer. So, for example, I had to go help her um, get her doctor's appointment going, pull it up online, pull up the website, get her to go through all the permissions of the computer itself with the allowing access to microphone, to camera, to everything. Everybody knows this. Um, and another issue was hearing. And so sometimes the doctor may not be talking loud enough. And elderly patients, some of them have hard of hearing, so they can't hear them. So they'd be like, what? And then the doctor would talk louder and they'd still be, it's a huge blockade that prevents the patient from telling the doctor what's going on, giving them an update, and prevents the doctor from telling them, exactly what they need to do either. Lack of internet, what I mean by that is like lagging. My grandmother lives in Amosville, which is just a bunch of woods. There's no, the Wi-Fi there is very spotty. So when we had the meeting, it lagged a lot. So the doctor would say something and then would pause for a good, like I'd say 10, 15 seconds. And then we would respond thinking that the doctor heard it, and then the doctor would move on to another thing, but we wouldn't get the response from the doctor for the first thing that we had. It was just very confusing, very conflicting, um, and just didn't work out. So lack of internet really is a big preventative thing for telemedicine and telecommunication because um, it just blocks all of that. Age, like I already said, this is a big thing, especially maybe if you're younger. I know a lot of kids, um, they know how to work technology a lot more than maybe even I do, so they should be fine. But it's mainly just for the elderly people. They have a huge difficulty dealing with computers. And my last disadvantage, which is just kind of a subway underneath that, a segue, excuse me, is the doctor-patient relationship could be strained because of that lagging, because of the age difference, um, because of time frames. It's stressful because you're both frustrated, or one of you's frustrated, the other one's just trying to fix things, and it's just very hard to deal with. Okay, so this is a chart from an article that I have listed in my references, of a chart where it shows the results of medical practitioners and how they use digital treatments tools before COVID and then during COVID. So as you look at the chart there, it lists from almost never to almost every day with um, pre-COVID and then during COVID. And during COVID, the almost every day, the bar is, a little above 80%. It's almost to 90%. So this is an improvement, which is very good because as you can see charts before, they were very hesitant because it goes from like maybe one or two times half a year to maybe a month or one or two times a week. Just very, it just skyrocketed, especially during the pandemic, because that's how we communicate with people. It's how we stayed in contact. Um, and it just really shows how um really show it really shows how telecommunication and telemedicine have helped society, specifically the healthcare workers, improve their patient doctor relationship and accessibility so that the patients can get what they need. This is also from the same article actually, and I'll just move myself over a little bit. But these are some quotes that I found from the article that give advantages, disadvantages, some critiques. Because of the study they did, they gave the patients a Google survey to where at the bottom it was like, if you have any suggestions of improvement, just let us know. So one of them was, it says part of the nonverbal communication gets lost, and with that also some of the connection with your client. So again, what I'm saying is um, face-to-face doctor appointments, you have the physicality, you have the hand motions, you hear the tone, you you're right there with that person. So it's a lot easier to explain to them what you're feeling, what you're like, what's hurting, how everything's going. Versus online, you miss a lot of those cues. You miss, like, you can see my face, you can see my reactions, but in person is completely different. Um, Another quote was, the largest difficulty concerns was the internet connection. It happens often that there is no stable connection or that the system is overloaded and then the tools do not work properly. So, just again, talking about lagging, lack of Wi Fi, maybe the computer is older and can't support the um, the tool that they're using, whether it's Zoom or Skype or any of the other healthcare professionals specific video tools that they use. Um, Another quote is a technological help desk that is easy to reach both for clients and therapists. So this is specifically a suggestion for the online communication, to where if you maybe call them and if you get put on hold for a long time, or you have to go through many different like directions, different phone numbers, different websites. It's very confusing. So having a technological help desk can take you specifically to where you need to go, and it'll help you get to where you need to go faster and talk to your patients or doctor or whoever you are. The chart on the left, I'm going to move myself over again, um, is the doctor's experiments, or excuse me, their experiences of the treatment, because they also took a survey where it was a scale of 1 to 10, one being the worst, five being the best, of how you think that the experiment went. And basically, the experiment was a bunch of patients were collected to have telemedicine conversations with their doctors, and they were both given different surveys to say how it went, what do they think, any improvements that they can give. And as you can see, they list it with issues and difficulties, advantages, and then some needs. So needs being technological resources, software features, any kind of support. So again, the help desk. Some advantages: very convenient, it's effective, it improves the client contact, and then it really just gives additional information on your home environment, depending on where you are, what you're wearing, how you're acting, everything like that. So it really kind of gives them an insight of how you are at home too, which can then help them give you a better diagnosis of whatever you need. And then, like I said, some issues and difficulties, some insufficient technological infrastructure, lacking organization or procedural support, um, client unsuitability, and then mediated communication issues. And this is my works cited. So basically, you know, um, telecommunication and telemedicine have improved health for, honestly, the globe, with everybody, with its easy access, time frames, um, depending on what you need, whatever doctor thing that you need to do. Um, it's like you can have the online appointment, and then from that appointment they'll determine if you need to have a physical examination, or obviously if you need like a surgery or something. It's just opened, like I said earlier in the introduction, it opened a whole new door of um, healthcare that really in the end just helps everybody. So thank you guys so much for listening. um, Hope you all have a great summer, and happy graduation to those who um, are graduating.